It's such a pleasure to be here. So just to kind of introduce myself, my name is Emily Williams. I am the owner of Evolution of Self Counseling and Consulting, just so you guys know who I am. I've been in the mental health field for about 10 years now, I suppose. I primarily work with patients with complex trauma and chronic suicidality. I work with the Greenville DBT Collective. I also teach at USC Upstate. I helped to found the Mentor Collaborative when it was in its baby stages. And that's kind of just a little bit about me. Today, I'll be talking about mentoring and mental health. And yeah, that's all I got to say about me. So let's just kind of dive into this. So this is just kind of an overview of some of the things I wanted to talk to you all about. Let me turn my camera because I can see the sun coming in. So we'll be going over some of the recent global events that is impacting mental health for our youth, recognizing certain mental health symptoms, promoting self-care in your mentees, I guess, and how to find appropriate resources in the community that will help our youth. So I wanted to talk a little bit about the global events impacting mental health and what to be aware of when you're interacting with youth. We've had such a number of things going on in our world that has been impacting how we are doing. It's how the youth are doing. Some of those global events, one of the most recent ones, is the conflict over in Israel and Hamas. I know there is a huge community response to this, in that a lot of our Jewish youth are reporting high fears and experiences. So we also just came out of a global pandemic. We've had a lot of political polarizations going on. There's just a lot of different things that our youth are contending with in this day and age that we, or I say we, and I might be older than some of y'all, did not contend with as youth at all. So one of the things I want to talk about is COVID-19. I mean, I know like we've talked it to death, right? We've said it and we said it and said it, but the things that you need to know in regards to mental health is that there has been a very sharp increase in anxiety and depressive symptoms in our youth. And this could be due to that period of isolation that our youth experienced during that year and a half. There was some relief that came in the early 2020s, as 2021, whatever it was, as they returned to school. But what we're finding in the mental health community is a lot of that is somewhat pervasive. We also saw ADHD and conduct issues kind of increase in children between the ages of 7 and 15. And this also could be because these children did not get a lot of social interaction in their most formative years. So they did not learn from social engagement. They did not get those feedback loops that they needed that says, hey, good job. That was the great behavior and this was not. They were kind of isolated. We have seen some small increases in suicidal ideation. And there's been an increase in pediatric attempts at suicide and these guys going to the hospitals. We've also seen increases in substance use in our higher risk youth. We've also seen, especially with those who are diagnosed with mental health problems. We've also seen an increase in restrictive eating disorders and symptoms for those who already struggle with disordered eating. Part of this is due, in fact, to the shortage of of food in general. So like when the schools left, there were some programs that were providing food, but there was also a lot of parents who were at work who could not go by and get that food. And so you saw a lot of our kids stop eating as much. And then you compile that with the messages for our teenagers in terms of body image issues, and we had a developing problem. Another thing for us all to be aware of is that at least it was like 204,000 children and teens lost their parents or some other type of in-home caregiver to COVID-19. And what that equates to is like 1 in 360 youth lost a parent or a guardian. 20% of those children experience very serious long-term problems, including long-term depression and long-term higher risk of suicide. So what happens when children experience grief is it kind of rewires the brain. It can lock the brain in a permanent stress response. It can heighten experience of anxiety, lead to panic. It can cause disrupted sleep. It can increase isolation and even affect their own sense of personal identity. Not to mention that these issues, such as increased anxiety, makes it much more difficult for children to engage in things like relationships and school and performance-based systems, which make up a great deal of their world, right? Like a great deal of their world is performative based. And so it makes it really hard for these guys to engage in these systems and feel successful, which then leads to a greater loss of self-esteem. I mentioned earlier the political polarizations. Like, I'm not one to get into politics and any type of training because that's not my jam. I know better. But what I should say is that adolescents have experienced this polarization in the US. They have experienced a greater concern about the social issues based on their political trends. They endorse more extreme political ideologies than what us older generations have experienced in the past. And sometimes they just reject the ideologies altogether. I think it was 40% of Americans reported that politics was a major source of anxiety, insomnia, and even suicidal thoughts. And so adolescents are increasingly exposed to these political news events that increase feelings of distress. So even if the children are not watching the news, let's say they stay away from it, they're not seeing the social media posts, their parents are. So these parental political beliefs and distress become how they operate within their family systems, and those are internalized by our children and adolescents. Females and children without parents with a college degree are at a higher increased risk of having their mental health impacted by these political tensions. Racism has also been another major topic in our social political world. We've had the recent riots, a lot of news related to the unfair shootings of minorities by police officers. It was happening at the same time as COVID-19, so you're getting these different messages at the same time, almost bombarding the brain of our youth. But even outside of the news part, chronic stress of structural racism like damages mental health. These experiences of racial discrimination are consistently linked with mental health issues like depression, anxiety, substance use, PTSD, and even like physical ailments. So they did some neuroimaging studies would suggest that these experiences of racial discrimination at a very individual level and structural level changes how the brain responds to threat. Now that's a whole lot of big words. What that means is that what they looked at is how like the areas of the brain change in structure, their form, based on experiences of racism, and they find that that is consistently changing those structures. And there is a greater like flight and fight flight response in some of those areas. Another thing with racism is that there's a whole group of populations that actually question the validity of reports of racism. So there's systemic racism, very overt behaviors, things that are obvious, and attitudes people just deny both the ones who perpetrate it, but also that the ones who are victimized as well. They will deny the experience of racism. So prior to the death of George Floyd by the Minneapolis police officer, there was actually not a lot of research around racial discrimination. And the scientific community actually resisted its exploration. They didn't want to look into it. But the fear of racism actually is very harmful and can undermine good mental health characteristics, such as things like resilience, hope, and motivation. And I went to the EMDR conference this past summer, and this wonderful speaker said, it's not if race is showing up in the room, it is how. Like it is always there. We can't deny that that is a fact. And along with race showing up in the room are all of the way that we have internalized the messages, not just what's showing up today in our media, but also what showed up for our parents, because they are also transmitting those same messages down to our youth. Microaggressions is one of the ways that racism shows up. It is a slow and steady assault on the mental health of our youth. There's actually 3 very distinct categories of microaggressions. They're micro assaults. These are like the insults that can be verbal or even kind of behavioral, like things that we're doing to antagonize or bother someone. There's micro insults, which just has these prejudice stereotypes that are kind of like insensitive comments, like making assumptions about intelligence, morality, or whether somebody belongs or not. And there's micro invalidations. And these are just comments that kind of devalue or deny the experience of marginalized people. The sneaky thing about microaggressions is they happen without conscious awareness of the person who is engaging in them. And they often do not know that their words are discriminatory at all. However, regardless of whether we're aware of it or not, these microaggressions have been linked to chronic stress, sleep problems, mental health problems, violence, poverty, risk behaviors like smoking and drinking, suicidal ideation, and even poor health outcomes. Another major factor impacting our youth is the social media. So social media apps and websites may have the exact same effect on the brain as a slot machine. The reward system involved in the social media is actually engaged when new content is presented, right? In fact, I think TikTok or one of them, they have like a 7-second thing, almost like you're getting the reinforcer of the new thing. And so the brain gets engaged and you're getting that constant like dopamine hit. And so the brain is almost wired to stay connected, keep trying for the next little video that's going to come up, that's going to bring us a little smile. And so what do we know about that system? It's addictive. So additionally, in addition to this addictive nature of social media, there is also a lot of feelings of invalidation or disappointment when a post or a picture doesn't get likes, or they're not getting the feedback from their peers that they were hoping to get. Another problem is that it's not just magazines anymore that have these unrealistic body images. Now social media has all types of filters which create these really unrealistic body images, and our social media is bombarded with them. And none of it actually exists in reality, and not all of the filters look fake, right? Like there are realistic looking filters that just change the body image, change the way faces look, that just project these unrealistic images. And then the kids are still matching up to those. They're still like, wait a minute, I don't look like that. Also, FOMO is actually a real thing. I don't know if they put it in the DSM yet or not, but it is a real thing. These kids are constantly checking their social media, feeling like they're going to miss out on something. This means they have less attention on their schoolwork, less attention to some of their extracurriculars. They have a lot more stress when they're disconnected from their social media. They can't hold information as long anymore because they're like, half the time they're in school, they're worried about, did they miss something on their social media? Did I miss a text message? What's coming through? And so their brain is not fully engaged in the content as somebody is presenting it. It also leads to feelings of exclusion when they are not included in certain social media posts. A lot of time it leads to feelings of loneliness or like increased anxiety. So now I'm going to kind of switch over to recognizing some mental health symptoms. Those are just some of the things that are like building up this mental health crisis that we are experiencing. I don't know if y'all knew we're in a mental health crisis, but we are definitely in a mental health crisis, and that we are seeing more and more issues present. This has been going on for a really long time. Even before COVID, we've been seeing an increase, but especially after COVID, during that, it's like an incubation period, y'all. Like this was already brewing, and then they was put in an incubator, and now we're seeing more things. So how to know what to look for, what to see, so that you know how to respond. Let's talk about that. Okay, so 50% of all people who have a mental health disorder in their lifetime start to experience their symptoms before age 14, which means it's all in our youth that we're looking for. The typical age for anxiety disorders to present is actually 6 years old. Mental Health America screened 11 to 17 years old and actually found the following information that I'm going to present. 83% screened positive for being at risk for anxiety. 91% screened positive for being at risk of depression. That's a massive amount of our youth. 83 and 91, 11 to 17 years old. And it's because of all of those things that I mentioned previously that are bombarding the brains of our youth, that are setting them up in this way. Some of the signs and symptoms that you should really look for when you're trying to assess whether the youth is presenting with some mental health symptom is the problems with concentration, difficulty accessing memory. If they say, I don't remember anything about my childhood, like that's usually a pretty good indicator that something is going on. An inability to think clearly. So like when you're talking to somebody and they are unable to really like give you a coherent message back, that's a pretty good sign that something's going on. They may also experience things like excessive worry. What that looks like might be like, oh, I got to get home and check, or I'm worried that something's going on with my parents, or they're overly concerned about their grades. Anger outbursts are usually a pretty good sign. And that can have varying degrees, like all kids experience anger at some point, and let's be mindful too that like in general the hormones kick that up a notch, but if it's repetitive, then that's really what you're looking for. Panic, like this looks like somebody hyperventilating, being fearful, sitting in a corner, trying to avoid. You may not be able to see any outward signs either, and what you'll just see them like clenching their fists or like really twitching or their legs shaking. Things like that can be indicators of panic. Changes in their appetite, feeling really irritable or restless. They may start isolating or not taking part in certain activities. If they are sitting off to themselves and the rest of the crowd is doing something, that may be a pretty good indicator that there's something going on too. Mood shifts, frequent ones, especially going up and down. If you notice somebody always has like closed in posture, and they have a hard time making eye contact, or they just present as always feeling sad. If they report that they're not sleeping much, and I can say the teens just are not getting enough sleep, they're actually supposed to get about 9 hours a day, and then they're staying up on their video games, Oculuses, social media, all types of things, and their prefrontal cortex, that thinking system, is not fully baked in the oven yet, and they need that sleep. Hearing or seeing things, and also like changes in how they dress. So if you notice that before they were usually very well put together, and they like and then suddenly you've seen a decline in hygiene in the way that they dress, that's a pretty good indicator that something's up too. There are certain things that you need to look for in terms of like knowing when emergency action needs to be taken. Some of those emergency actions can be things like if you notice your student is giving away possessions, but there's no real logical reason. If you notice that the student or mentee, I guess it's mentee for you guys, has a preoccupation with death, or they talk a lot about it. Sometimes it comes out as jokes too, right? Like sometimes you'll hear themselves like, "Oh, I'll just kill myself," and it'll come out like it's funny, but they're doing it repetitively. And let me just say that kids do that these days anyway. But like if you hear it a lot, it means it's going through their brain a lot. Any drastic personality changes, if you see them being really risky, engaging in risky online behavior, sometimes that means giving out images that may not be appropriate for their age. It could be getting in the car with people they don't know. It could be using substances. If they're withdrawing from life, meaning like they used to be pretty engaged and they suddenly are not participating. If you ask them what their plans are for the future and they're like, I don't see a future, I don't know, that's a pretty good indicator. If you see them using more substances, if there's a sudden hike, now let me just say that all substance users are not in need of emergency action, but if you see a drastic increase, that's a pretty good sign. or if there's indirect or direct threats of suicide. So there's a ton of risk factors for mental health problems in youth. So these are the kind of things I may want you to kind of put in the back of your mind as things like, not that these cause anything, but it does increase the likelihood. So if the kid has low self-esteem, if they feel like they're not really good at anything, or like if they're constantly repeating things like, there's always a negative interpretation for why something happened. You're looking for that. Females, LGBTQ members, and minority groups are at higher risk for mental health problems. And I'm not going to go through this entire chart. I'll give TJ the PowerPoint. You guys can utilize it and look at it. But these are just to name a few, like family conflicts, if the parents are unemployed, if you're noticing like aggression towards peers, just poor academic achievement, just lots of different things. Some of the protective factors. So protective factors basically mean that like, despite the risk factors, if you have certain things, it decreases the likelihood that a mental health disorder will happen. So the idea behind a lot of mental health, even in therapy, is what we want to do is decrease some of these risk factors and increase the protective factors. So that includes things like physical development. You want to get them exercising. You want to get them involved in school. You want to help build up their self-esteem. If you can do anything, if you have any access to help the family provide some structure and rules and predictability in their environment, I say families and, well, kids and animals respond to structure and love, period, right? Like they just do better when there's some kind of consistency in their world. If they are involved in some kind of community activity or school activity like sports or art club or whatever it is that develops their interests. You guys, of course, mentors, any way that they can get support for their skills or interest, teaching them emotional regulation skills, like how to cope with their bigger feelings, obviously physical and psychological safety. And when there's clear expectations about what their behaviors are and even their values. I often stress in therapy, like really knowing your values is probably one of the most important things that a person can do, because what I value and what TJ values is not going to be the same, right? And so if I'm acting in accordance with my value, my path is going to look different than what somebody else is going to look. And so if I know what they are, then I can make decisions based on me rather than what my peers are pressuring me to do or what other things are popping up. I can decide for myself. All right, so let's talk about ways to promote self-care in your mentees, and maybe even some crisis strategies, like what to do if, like, all right, things are getting hairy and you don't know what to do. First is self-care is the real mental health first aid. It's preventative in nature. We want to respond before there's a problem, not after. So you hear lots of stuff about self-care out there. What does it mean? There's tons of memes and GIFs and all kind of different things. Self-care actually is the ability to take care of your own health and well-being, period. It can include so many different things, like in taking care of your emotional health, taking care of your physical health, but also taking care of your social health as well. Emotional resilience is our ability to adapt with new stressors. Like, so life is not going to stop being stressful. Like I've even said many times, pain is inevitable, but suffering is actually optional. It is your ability to develop this resilience that helps us move through life, because there's going to be stressors. Emotional resilience is the idea that you're not avoiding your problems, but face them as they come while giving yourself some compassion, right? For whatever it is. Like, even when you don't handle it well, the ability to give yourself compassion for those moments and then get back into a space where you're handling things better is huge. Oftentimes our youth have a really hard time with this because they won't handle something well, and then they get a lot of shame about it, and then they start beating themselves up, and they didn't have good self-care in the beginning, and now they're not having good self-care on the back end either, and like further causing problems for themselves emotionally. They can further their development of problem solving skills, which is also huge, right? Like, even emotions can be problem solved, right? Like, I'm feeling sad. What do I need to do? Well, I need to engage in an activity that will change my mood, right? There are ways to problem solve your own mental health. Any type of emotional resilience helps you really to recover from the hardships and move forward. Which leads me to, before we take care of others, we have to take care of ourselves. So this is not just about our mentees. Um, we we have to take care of ourselves, or we are going to negatively impact the people that we take care of. That is so important. So personal burnout can lead to a lot of professional and even volunteer impairment. Chronic stress can lead us to feeling disconnected, which means that we're not attuning to the people we're taking care of. We're not checking in with them. We're in our stuff and not in their stuff. And which can make us a lot less sensitive to their needs. And it can also make us a lot less empathetic in our interactions, which actually in the long run can cause more damage to somebody who might be coming to us for support. When we ourselves are under strain, it's a lot more difficult for us to be flexible and creative in our strategies and in our thinking. And, mentees will look to you to provide examples of what healthy emotional regulation looks like. And if you aren't taking care of yourself, how can we really expect mentees to know how to take care of themselves? So self-care does look like different things to different people. What I can tell you is what it isn't. Self-care is not this like pampering or like treats or all of this like, oh, I need to go to the spa. That's not self-care. Well, it can be, but like, it's not like this constant way of pampering yourself. It's really not about putting your needs in front of others. It's not this huge list of behaviors that you need to perform. And it isn't always this like, I need to be alone, I need to go away from people, I need to do my self-care, right? But what it is that it's as much about what you're thinking as what you're doing, right? It's taking the time to do things that help you to feel good about your life, to live well, improve your physical health, and to improve your mental health. It's also about considering stress management strategies in order to lower your risk of mental illness. So here are some actual ideas for self-care, like getting regular exercise, making sleep a priority, trying some relaxing activities, getting outside, making sure that even when you don't feel like it, you stay connected with others, cooking at home, making sure you get to your doctor's appointments, your dentist appointments, those ways of like really tending to you. All right. So sometimes mentees will present with things that are like over your head, right? Like it's major crisis. You don't know what to do with it. Sometimes their emotional system is just so overwhelmed that you can't even rationalize with them, right? You're like trying to talk them through it. But when somebody is in emotional crisis, that thinking system is offline, like it's not working. When you try to rationalize with somebody who's emotional, you're not going to get through anything. Have you ever seen those parents that like lecture again and again and again, and their kids are still all in the emotion mind piece? And it's like the kids don't get it because they're not talking to the right system. It's just not effective because they are currently in fight or flight. So they need to, that's what they want to do. They either want to fight you or they want to get out of there. When your mentees are in fight or flight, there actually are some things that you can do to help to reduce the intensity of emotion. Now, I must say, these are not long-term strategies, okay? These are like, it'll buy you like 20 minutes. My main advice for somebody who is in a crisis situation is to do what you can in the moment and then get them to somebody who can help them more long-term. Some things that you can do to help your mentee reduce the intensity of emotion. So sometimes when there is an emotional crisis, the emotions are very, very high. One of the strategies is to help your mentee to distract and move through the emotions that they are feeling. So what this can look like is find an activity that they can do. Actually, the more complex, the better. Meaning that the more you can get an activity to take up a lot of mental space, the less room they have to be in their emotion mind. So sometimes I'll tell them to tell me what 346 times 232 is, and I ask them to do it in their head. I don't care if they get it right. What I want them to do is to be working in their complex thinking system. Sometimes I'll ask them to give me directions from their house to the nearest Starbucks, taking me road by road, which also brings up their mental map, because if they're in their mental map, they're back in their thinking system and not in their emotion system. They can also find a way to contribute to the well-being of others. So this idea of contributing gets them into a space of altruism. So if they're really, really upset, well, why don't we go help this person over here? And that takes the focus outside of them and onto somebody else. And then they also get the feel-good chemicals of that altruistic behavior. Sometimes it's helpful to remind the person of things that they've been through in the past. Like, look, man, I've seen you go through things that are 10 times harder and you came out the other side. So if you can do that, you can certainly do this. We just got to figure it out. That can be really helpful. Change your emotion by looking at something funny. Like, really what you're trying to do is just shift the feeling a bit. It can be listening to music. It can be doing something super silly too. Like sometimes I'll have my patients sing Wheels on the Bus Go Round and Round just because it's fun. And then they'll feel ridiculous. But if they're feeling ridiculous, they can't be in that high intense emotion. Sometimes I even ask them to skip, because like I have this theory that you can't actually be sad and angry and skipping at the same time. Haven't proved it. There's no research to back that. I just say that. Like, how can you ping pong one place to another? I don't know. You can also change thoughts by counting, recalling a favorite recipe, getting those directions from one place to the other. You can use calming imagery, ask them to imagine the place that they feel the safest and the calmest. Sometimes like mindfulness can help. Sometimes a prayer can help. Also just taking a break, like be like, hey man, like this is a tense situation. Why not go take a walk, come back to it? We can hit it up then, or just like using encouragement. Radical acceptance is a skill that I teach in therapy. And this skill is a concept that life situations are exactly what they are. And it is what it is. Like, that's a skill. Can you imagine that? Like I teach that. It is what it is. Like people haven't heard that enough. But it really does take a lot of emotional energy to fight reality. And mentors and mentees alike really can get caught in the idea that it's supposed to be different, right? So radical acceptance is actually about learning to accept situations as they come and choosing to navigate them as opposed to fighting the fact that they exist. It also means that acceptance does not mean that we approve of something. So there is a huge distinction, right? Like a lot of times people think that if I accept this situation happens, I'm giving it the seal of approval and that means they're going to keep doing it. That's absolutely not true. It just means that you see the situation for exactly what it is and choose to move through it in the most effective way. If it's already happened, it's already happened. Now what? So I'll give you a little story because sometimes stories are the best way to illustrate these points, and even one that maybe you can use with your mentees too. So when I was little, I hope y'all are old enough to know what the original Nintendo is, because my brother would play it like all the time. I would play it too. But my brother was one of those guys that like when he played, he would get really upset at the Nintendo and he would like scream at it and flail the cord around and all of that good jazz. I, I hope y'all know somebody like that, right? So you can get the right image that just flails all the stuff around. Well, back in the dinosaur age of video games, the cord was actually connected, right? So there was a little bit more to that. So my brother is world 8 of the Super Mario Brothers, these long fireball things in this world. And he just, for the life of him, could not get through this world. And so what he did was he started flailing the controller around, arguing about it back and forth. And when he did, the cord jerked the Nintendo down, the thing went crashing. And like there wasn't like really good cassettes then, so when it crashed, like they were kind of old and it erased the memory. So not only did he not pass the world, he had to start all the way over at the beginning. So we can get into a lot of emotional dysregulating, fighting the fact that the world is what the world is, or even the things that we did are the things that we did. We have a lot of that, and that's great. And it can be justified too. Sure, those long fireballs were really tough, and it's justified. It's hard to navigate it, but it doesn't actually help at all. The world still is what the world still is. So the best thing we can do is figure out how to navigate it and how to move through it. And my brother, it wasn't until he was able to calm down and think and get out of that emotion mind space that he was able to begin to navigate that world. And so helping your mentees to radically accept whatever the situation is probably one of the best skills you can give your mentees to use, even when those circumstances are ugly and hard and difficult. All right, so sometimes mentees do not have enough resources to be everything that their mentees need. And sometimes they need additional care. Finding the right mental health supports for your mentees really depends on their age and the signs and the symptoms that they're showing. I would say encourage your mentees to talk with their primary care physicians about any concerns that they tell you about. There's always more than one way to skin a cat when it comes to mental health. Like preachers and churches are often a really good source of support for mentees and their families. Guidance counselors are also really helpful in exploring the needs of mental health care. Schools nowadays, they all have mental health counselors on staff, which is fabulous, and they can be accessed as long as you have permission with parents. If the crisis is high and your mentee or is actively suicidal or is making threats, you may need hospitalization. Calling 911 might be the best resource for that. And I just also wanted to remind you guys that mentors are mandated reporters. And any reports of child abuse or neglect, or even if you suspect child abuse or neglect, you should contact them. And I always make that thing is like, just because you call them doesn't mean that like they go and take the kids away. So if you have a concern, it really just alerting them to investigate further. If there's nothing there, then there won't be anything to worry about. So always err on the side of caution and call versus not call. That's the number. These are just a list of counseling numbers that you can consider if you need to find those mental health resources. And again, TJ will have this presentation. He can share it with you all. These are some additional crisis resources in our area. We have the new 988 suicide and crisis line. There's also the Department of Mental Health has a mobile crisis. So let's say your mentee calls you and they're a real sticky situation. Mobile crisis will actually go out to the home of the individual and be there with them along with the police officer. There's also Mental Health of America. If LGBTQ, we have the Trevor Project that helps with suicidal risk, the National Suicide Prevention Hotline. We also have places to go for sexual assault, Carolina Center for Behavioral Health, Marshall Pickens are good resources. And there you go. Those are my references. So if anybody has any questions, I am happy to answer them.